This video clip is produced to help you understand basic treatment at the ICU after liver transplantation. We will first look into the following. There may be pain in the surgical site. Proper pain control will be helpful for the patient's recovery. Pain control stabilizes vital signs and reduces anxiety, leaving patients feeling comfortable. The pain assessment scale is used to measure the pain level of patients in numerical values. Depending on the pain value, non-pharmacological treatment as well as narcotic analgesics or non-steroid anti-inflammatory drugs may be administered. If needed, pain-relieving patches may be used. ICU patients will be treated with central venous catheters and peripheral arterial lines. The central venous catheters are inserted during the operation to administer various drugs and to indirectly measure the amount of body fluids. They will remain until the patient is discharged from the ICU. Another type of central venous catheter may be inserted for dialysis or plasma exchange. If there are signs of infection or dysfunction of the catheter, it may be reinserted in the angiography room. Arterial lines, A-lines, usually inserted at the wrist, are used for measuring blood pressure and sampling blood. When A-lines are unintentionally removed, it may lead to bleeding. They are usually removed when patients are discharged from the ICU. Pressure will be applied upon removal to prevent bleeding. It takes approximately 20 hours to complete liver transplantation. A Foley catheter is inserted during the operation for urination. The catheter is not removed during bed rest after the operation because it is needed to measure urine volume. The attending physician will decide when to remove the catheter. The characteristics of the patient's urine are observed while the catheter is inserted. The insertion site and perineal region are disinfected regularly. After surgery, liver recipients generally have 6 JP drains that are connected to the surgical sites, such as the abdomen and the thighs. Drains are squeezed to produce negative pressure. Negative pressure helps to discharge fluid collected within the surgical margin. At first, the fluid appears bloody and red. In time, the fluid will become transparent and the amount will decrease. The medical staff can detect complications of the surgical site, such as bleeding, peritonitis, and bile leakage, by observing the collected fluid. The drain lines are frequently squeezed to prevent blockage. The bile drainage catheter is inserted into the biliary tract to expel any bile leakage from the surgical site. Medical staff will observe the characteristics of the collected fluid to determine whether the transplanted liver is functioning properly. If needed, a saline solution may be used to irrigate the drain in order to prevent blockage. The medical attendant regularly disinfects the wound according to the patient's conditions. If the dressing becomes wet due to secretions, it should be replaced frequently. Medical staff will observe for bleeding or infection when disinfecting the wound. The patient's condition and drug concentration levels can be evaluated by conducting blood tests 4 times a day at 6-hour intervals. Blood tests can show signs of bleeding, abnormal liver enzymes, electrolyte imbalance, and inflammatory responses. Due to frequent blood sampling and patient discomfort, blood collected during ICU care will be completed through the arterial catheters. However, if a blood culture test is needed, it may be done through the peripheral blood vessels. X-ray examinations are conducted for close observation of pulmonary and abdominal complications, such as atelectasis and pneumonia. Generally, chest X-rays are taken 4 times a day at 6-hour intervals, while abdomen X-rays are taken once a day. After surgery, ultrasounds of the transplanted liver are conducted to evaluate blood flow of the connecting vessels. It is conducted every day for 4 days after the surgery. Contrast media is used on the first and fourth day of the ultrasound. Therefore, informed consent is required. The CT is conducted to check the condition of the transplanted liver. Generally, it is examined on the 7th day after liver transplantation. However, if there are abdominal liver enzymes, signs of bleeding, or abnormal blood flow, it may be conducted before the 7th day. Since the CT requires contrast media, informed consent will be needed. If any abnormalities are detected during observation, interventional procedures may be done to correct them. For bleeding, the bleeding vessels will be identified and controlled at the angiography room. If stenosis of the connecting blood vessels is observed during an ultrasound, a stent will be inserted at the angiography room. If a pneumothorax is detected, a chest tube will be inserted into the thoracic cavity to expel the trapped air. Any procedure completed at the angiography room requires informed consent. You have received information on basic treatment at the ICU after liver transplantation. You will fully understand and be informed of several basic treatments at the ICU in this educational session.